Quick note. This is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you're sneezing constantly or breaking out in hives, you're probably wondering if allergies are the culprit. Mayo Clinic says about 50 million Americans experience some type of allergy annually. But before you spend money on tests or treatments, you need to know what you're actually allergic to. This video walks through exactly how much allergy tests cost in 2026, how the testing actually works, and the simplest way to order them online without needing a doctor's appointment first. We're pulling information from Mayo Clinic, the NIH, and Medline Plus, so you get the full picture. According to the Cleveland Clinic, there are 3 main ways doctors test for allergies. First, there's the skin prick test. A technician pricks your skin with a tiny needle containing allergen extracts and watches for reactions. Second is the intradermal test, which goes a little deeper into the skin for more sensitive allergen detection. Third is the blood test, which measures your antibody response to specific allergens. Each test type has different accuracy levels and costs, which we'll break down in the next section. Let's talk money. A single skin prick allergy test typically runs between $100 and $400 at a traditional clinic, depending on how many allergens they test for. Blood tests are usually similar, roughly $150 to $500. But here's where online options change the game. Home allergy test kits you order online range from $50 to $300, depending on the company and how many allergens they screen. Insurance coverage varies wildly. Some plans cover in-office tests completely. Others cover maybe half. Always check with your insurance before ordering. Let's walk through the science. Medline Plus explains that during a skin test, the technician applies tiny amounts of allergen extracts to your skin, usually on your forearm or back. Then they wait 15 to 20 minutes for a reaction. If you're allergic, your skin will develop itching and swelling, kind of like a mosquito bite. Blood tests work differently. Your sample goes to a lab where technicians measure immunoglobulin E, or IgE, antibodies specific to each allergen you're tested against. Higher IgE levels mean you're more likely allergic to that substance. So can you really test for allergies at home? Yes, but with a caveat. Several companies now offer home allergy test kits where you either prick your own finger for a blood sample or mail in a saliva sample. Popular options include Everly, Well, Let's Get Checked, and similar services. They mail you a kit, you collect your sample at home, mail it back, and get results within a week or two. The convenience is real. But the accuracy isn't always as high as in-office tests, especially for skin testing. Most of these home blood tests are legitimate, but they're screening tools, not diagnostic replacements. Once you get your results back, whether from an online test or in-office visit, that's when the real conversation starts. If your blood test shows elevated IgE antibodies to certain allergens, that's useful information, but it's not a diagnosis by itself. The NIH emphasizes that you should discuss those results with a healthcare provider who can help you make a plan. Some people get allergy shots, others try eliminating the allergen, and others use medications. The results are just the first step toward managing your allergies more effectively. Here's the honest comparison. In-office skin prick tests are generally more sensitive and give faster results. You know within minutes if you react. They're better if you have severe symptoms or complicated allergies. Online blood tests are cheaper, more convenient, and work from home. But they only screen for allergies. They don't diagnose. The Cleveland Clinic notes that false negatives and false positives are possible with any test. So if your results seem off or your symptoms aren't improving, follow up with a doctor. Online testing is great for screening, but in-office is more thorough. Home tests are convenient, but there are times you genuinely need a clinic visit. If you're having severe allergic reactions, difficulty breathing, or swelling in your mouth or throat, don't order a home test. Go to urgent care or an ER. If you've had allergy symptoms for months without relief, a doctor can rule out other conditions like asthma or infections. And if you're considering immunotherapy or prescription allergy medications, you'll need a doctor's evaluation first. Mayo Clinic recommends talking to your primary care doctor if symptoms are getting worse or aren't responding to over-the-counter treatments. So here's your game plan. If you suspect allergies, start with a home screening test to get baseline data. They're affordable and give you actionable information. Then take those results to your doctor for discussion and a proper management plan. If you're already on allergy treatment and want to verify it's working, a home test can help you track progress. And remember, allergies are super common and very manageable once you know what you're dealing with. The investment in testing pays for itself the moment you stop suffering through symptoms you could have avoided.